having done some work in Missouri, having done some work in Florida, Texas, California, one thing I see is that if you have women, particularly young women in the 18 to 25-year-old group, if you have the ability to connect them to the women's clinic, you will never lose them. You'll never get rid of them because you have offered them something they want. They want to know how their body works. So again, I know that this particular series has been pretty much weighted on the side of males, but I would be remiss if I didn't mention the OBGYN services angle. Okay, well, what about psychological issues? I need a little help here, Clyde. We're not moving here. In getting to the psychological issues. Clyde. Well, I'm going to read it to you. And then when Clyde gets back, I'll put it up there. We're not moving. It's not moving. Okay. Research suggests, there we go, that the human brain is still maturing during the adolescent years, continuing into the early 20s. It had been assumed previously that brain development occurred during adolescence. However, recent research has shown us that the brain is not fully formed at puberty, but continues important maturation that is not completed until age 24. And we're talking about the prefrontal cortex, which inhibits an individual's ability to multitask. Think of all of the things that you ask individuals to do in drug court. They need to multitask. But these 18 to 25-year-old young adults, they are working with less than 52 cards in the deck. They may be working with 45, so they're going to need another type of intervention. They're going to need some assistance. Now, with these psychological issues, let's just go back for a second and review what are the developmental issues of the young adults. You may recall, back on the 14th, we talked about, I should have put interpersonal relationships are very important for them to master during what I call this middle passage between adolescence and adulthood. And these personal relationships cannot be attained through business relationships or organizational relationships. They may be, and this is a maybe, they may be obtained through support groups. They may be attained through 12-step groups. But then again, the researchers are making a very big point about how these interpersonal relationships are so important during this phase. Secondly, advanced intellectual function. Adolescents have intellectual function, but last week I used the example of a checkbook. The concrete skill of balancing a checkbook, adolescents can do. But the advanced intellectual function of creating a budget, they may not have the ability to do that, and our 18 to 25-year-olds may not have that ability also. So we may need to work with them around this particular deficiency. Thirdly, in terms of developmental issues, entry, work, and career. And I mentioned to you, I used an example from Buffalo. The Buffalo Treatment Court has an excellent relationship with Erie County Community College, where they refer many of their participants to Erie County Community College to get started on this particular developmental issue. It's very important. It's so important that just visually you can see the change. Their body language changes completely. They feel better about themselves. all of a sudden they're a college man. All of a sudden they have some direction. They have some focus. So again, extremely important for us to assist them with that developmental issue. And lastly, the moral and ethical reasoning domain. Now, extremely important. Many therapists have written about this, and it is beyond mutual benefit, which is the basic moral and ethical stage. As long as it's good for both, for more than one or two people, it's going to be fine. But we'd like them to move on from there, and we'll have more things to say about moral reasoning as we go through the material. Well, given an individual whose brain has not matured fully, what types of strategies should we be employing when working with this population? And we started to talk about this last week. We want to promote activities that capitalize on strengths of the developing brain. We don't ask them to do things that you know they are not able to do. So, what activities can we capitalize on the strengths of a developing brain? Music and sports. They're very good at that. But you talk about planning, you talk about budgeting, they may have some difficulty there. You want to, as a strategy, assist with challenges that require planning. Again, probation officers may not need to do more monitoring so much as they may need to give these individuals assistance with planning because, again, they tend to struggle with that. We want to reinforce the value of advice. We want them to encourage them to seek out advice. Advice is a good thing. It's good to get a second opinion. We want to educate them about risk-taking. We want them to be aware of the fact that with risk-taking, there are consequences. So again, very often, they're not even aware that there are consequences for their behavior. We would like to make a point about substance abuse. As you scour through the literature, what keeps coming up over and over again is drugs hijack the brain. Well, if they hijack the brain, we want to caution them about continuing to use drugs, even if it's only marijuana. Okay? And we're going to have to be a little flexible in tolerating the oops behaviors, because oops behaviors will occur. And lastly, there's a bullet here that I would love to add, but I'm just going to say it, and it's the word blending. In working with this population, until we have more evidence-based types of interventions for working with this population, we may need to use what we know works for the juveniles and what we know works for the adults and mix and match. Because again, right now, that is the best we might be able to do in our particular jurisdiction. So those are some strategies. What about effective interventions? What should we do? Well, first up, assessment and reassessment. There is an expression in substance abuse treatment. Assessment is an ongoing process. You don't just assess someone one day when they first come into the program and that's it. You have to, with this population in particular, what you have to do is assess and reassess. So it's ongoing. We want to enhance internal motivation. We want them to want to change. We can't change for them. And the literature makes many suggestions. And probably one of the suggestions that we hear over and over again is we need to train all individuals who are working with this population in motivational interviewing, just essentially to get them to become internally motivated. Because if they are not internally motivated, we're running uphill. We need to target interventions. And the one thing that I would like to stick with you is no idle time with this population. You want to target the intervention so all the time gets filled up in positive types of activities. You want to skill train. And when I talk about skill training, what I mean is cross-training. The probation officers have to know what the mental health folks are doing. The mental health people have to know what the substance abuse people, what their goals and objectives are. Everybody needs to be on the same page. Okay? We would love, in terms of effective interventions for the course, to increase positive reinforcement over negative reinforcement. And repeatedly, as you go through the literature, what keeps coming up is this 4-to-1 ratio. That should be the ratio that you are targeting. Essentially, for every 4 positives, you have 1 negative. Okay? In many courts, it might be the reverse, so we need to examine that and look at it. That takes into consideration, what are we doing with incentives and sanctions? We need to engage ongoing support in the community. This is connected to sustainability. This is connected to a number of things because drug court probation is not going to be around forever. But the services that currently exist in the community may have a longer shelf life than the drug court experience or their probationary experience. So we want to connect them to help in the community. And we would love to have us measure relevant practices. Don't start a new practice and not keep track of any changes in your outcomes, in your retention, in your graduation rates, in your sanctions, in your incentives. You need to measure your relevant practices, and once you measure them, get back to individuals, let them know, how are we doing? How can we improve these particular interventions? Because again, what happens over and over again, if your interventions, if your protocols has not changed in 3 years, let's say you've been in existence 5 years, but your practices are identical to how they were when you first started out, something's wrong. Because your population changes ever so slightly over time. So again, you want to provide feedback to determine how can we make this a little better. Well, we mentioned that many individuals in this 18 to 25-year-old cohort essentially have co-occurring disorders. Now, what is recommended in the field around co-occurring disorders? And again, I'm going to be sharing with you at the end of the session a list of references, websites, etc., where you can get more information, where you can find out more about cognitive behavioral models. But again, as far as the co-occurring audience is concerned, at least 1 year of treatment is recommended. There is no one and done. There is no quick path here. We have to roll up our sleeves and earn our paycheck. So at least 1 year of treatment is strongly recommended, not even recommended, strongly recommended. We need to constantly, with this population, have extensive assessment. The emphasis should be on psychoeducational approaches or cognitive behavioral approaches. That's what's going to essentially assist the individual in that 18 to 25-year-old range. As far as staffing goes, we need to have high staff to offender ratio. And the literature repeatedly recommends we need more mental health specialists working with this population. So again, that's something to think about. That may be a monumental task for many courts. They just may not have the availability of more mental health professionals, but nevertheless, that's what the literature is recommending. And I mentioned this earlier, cross-training of all staff. All staff needs to know what other disciplines' goals and objectives are, and what they are, and how they essentially are going about their business to get there. And lastly, we've mentioned this, we need to be with the co-occurring crowd supportive and not so much confrontational. Being confrontational, that's like talking to the wall. It's spitting into the wind. It's not going to essentially pan out favorably for you. Well, what about supervision? Well, what about this 18 to 25-year-old young adult? Well, there's less motivation to change. At this point in your life, think about yourself when you were 18 to 25 years of age. You were pre-contemplative too. You knew everything. You didn't want anybody to tell you anything. Okay? Very difficult audience to work with. When I was working at probation, we used to call these individuals the PCs because you earn your check working with this crowd. Okay, something that may help, be of help. I've mentioned it earlier. I'm going to mention it repeatedly. I'll mention it again. Motivational interviewing. And lastly, something that many jurisdictions have observed, increased supervision with this audience may produce more violations. So increased supervision does not necessarily decrease violations, but it may increase violations. And again, that's not something that we want. So again, we just need to examine our supervision and how we are going about supervising our probationers. Okay. Back to the brain. The area of the brain related to reasoning and problem solving is the last to mature. That's the prefrontal cortex. That part of the brain that helps organize, plan, and strategize is not completed yet. And we're talking about the prefrontal cortex. Think of the tasks that we ask young people to complete as they work their way through drug court, through the phases of drug court. We require, as a result of their psychological issue, we require enhanced and motivational case management services. That's going to put a lot of onus on the case manager. And last week we talked about what are the attributes of a case manager that we should be looking for, because this is such an important piece in the equation of working with our young adults. Well, that's what we covered last week. And I shared with you last week that I'm going to share with you a list of references now so that you can expand your knowledge base and sit down and actually plan how better to work with our young adult population. Well, Arlen talks about cognitive development in adulthood. And again, for many of you treatment providers, this might be something that you might want to have a good read on here. And again, we talk about one of the developmental issues of the young adults is advanced intellectual development. We need to know how that works and how to promote it. So again, a very good article there. Erickson, the granddaddy of human development, wrote a piece way back in the dark ages of 1968, Identity, Youth in Crisis. It's what we call a foundation piece in this particular field. Gilligan, Mapping the Moral Domain. Now, one of the developmental issues, one of the four, is moral and ethical development. And Gilligan pointed out a discrepancy here. And she said basically that with the moral mapping, with the moral domain, we may have underscored women's moral development because women are more caring, they nurture, and again, many of the works around moral development that have been done concentrated on males. So again, if you have females in your court, the Gilligan book might be a book that you might just want to take a quick read on. Okay, what else do we have here? Also in moral developmental area, Larry Kohlberg, recent research in moral development, extremely important. We don't want people out there thinking immorally or thinking essentially off scheme, so to speak. We want to produce solid citizens when they graduate from drug court. We want them to be making good decisions, and decision making is what life is all about. Next, Jean Piaget, The Origin of Intelligence in Children, again, enhances your outlook on intellectual development. Donald Super, Career Education and the Meaning of Work. Now, this is in a government document coming from the U.S. Department of Health, Education, and Welfare, the Office of Education, because we know that work and career are extremely important for these young adults. It's one of those 4 developmental issues that they have to take care of. Somehow, if we have them in drug court, we have a golden opportunity to essentially meet their needs, if we can. So again, for you courts who have the ability to send them to community college, where there are job fairs. And again, it may not be so much how to fill out a job application, but it might be what skills must be developed in order for a person to even know what career they're attracted to. And again, community colleges are excellent, and they are prepared to meet that need. Well, what about supervision? From the National Institute of Corrections. Now, they were doing community corrections work in this particular document, and the title is Implementing Evidence-Based Practices, the 8 Principles of Effective Intervention. Now, I have to share something with you now. I've used the term evidence-based practices. And what needs to be made aware of here is that when we talk about evidence-based interventions, we're talking about it's backed up with scientific data. Science is there. It's been proven that these interventions work when used appropriately. So, the National Institute of Corrections has listed that out, and that's where you can get it. Next, CSAT, the Center for Substance Abuse Treatment, Enhancing Motivation for Change in Substance Abuse Treatment. And you see there it says Treatment Improvement Protocol, the TIP series number 35. Now, let me have to backtrack you. In a democracy that we have in this country, the federal government, by law, is obligated to share with the public all of the research that is conducted that is government funded. So how the government chooses to disseminate that information to the government, to the public, I should say, is through the National Clearinghouse for Alcohol and Drug Information. One of the things that you can get from the National Clearinghouse is a bevy of manuals entitled the TIP series. Tip number 35 is concerned with enhancing motivation for change in substance abuse treatment. All of us that are listening to this webinar, we're in the behavior business. We want to motivate change. How best do you do that? This particular manual will share with you all the research findings that have been gleaned over time with government money. And the best thing about the TIP series is that it's free. And there are not that many things that are free these days. I'm going to be sharing with you a number of different, as we call them, tips in the business that can be extremely helpful in assisting your court in designing a new model or tweaking your current model. Okay, because motivation for change, extremely important. And while we're talking about change, we need to talk about the granddaddies of change, Prochaska and DiClemente. In '94, they wrote a book, Changing for Good. And if you can recall, if you've been to any stages of change training, you have essentially, you may remember, they would share with you the wheel of change. And they would say, you know, you can drop off the wheel, and then you can get back on. What Prochaska and DiClemente are addressing here is, how can you change for good? Okay, how can we improve the change process? So again, an excellent read there. Next, Faye Taxman on supervision, specifically exploring the dimensions of effectiveness. And this is in the federal probation literature, September 2002. And basically what Ms. Taxman is saying is that we need to do less monitoring and give them more assistance. Remember some of the issues of these young adults. They can't remember. They can't plan. They don't have higher intellectual function. So again, we just may have to tailor our supervision to meet the needs of this population. Okay. Here we go, another tip series from the Center for Substance Abuse Treatment. Substance abuse treatment for adults in the criminal justice system. Now, this is near and dear to those of us at NDRI because one of our colleagues, Dr. Harry Wechsler, was on the expert panel that put tip 44 together. So again, I would strongly suggest as a resource, just have it in your office. You don't have to know everything in it, but if you essentially would like guidance on an assessment instrument or how to set up a particular evaluation for a particular intervention, consult tip 44. Another one, Center for Substance Abuse Treatment, integrating substance abuse treatment and vocational services. That's tip number 38. And again, I will share with you a phone number and a website where you can order these particular documents. And we know vocational services are essential because that is the number 3 dimension or developmental issue for our young adults. Okay, what else do we have? Norcross and others, evidence-based practices in mental health. That comes from the American Psychological Association. Well, why should we not benefit from all the work that's been done by our colleagues in a different discipline? So, mental health has its own discipline. They have evidence-based practices that have been scientifically proven to be effective. And again, the Norcross document or the Norcross book would, again, assist you in shedding some light on what direction you may want to go in. And just below there, you see another CSAT document on co-occurring disorders. This is Treatment Improvement Protocol number 42. The expert panel in putting together tip 42 was led by one of our colleagues here at NDRI, Dr. Stanley Sachs. So again, near and dear to us here at NDRI, but some excellent advice there, an excellent resource for those of you who may need assistance in this particular area. Okay. What about assessment? And many of you are perhaps changing a risk assessment instrument or putting one together for the first time or shopping around. And what LaTessa is attempting to do here is clear the air. What's the role of the offender risk assessment tool and how to select them? And many of the courts out there in the country, this is what they're doing right now. They're trying to ascertain what assessment instrument it meets our needs in our particular jurisdiction. Last week, I shared a story with you that came from Oregon. I conducted a training, At the end of the training, a young Latino gentleman came up to me and said, share this story with other courts so the same thing doesn't happen to them. And I asked him, well, what happened to you? He said, well, we put in a lot of time and effort in developing a new risk assessment instrument, spent a lot of money, got a lot of hot shots in there, people that were very much seasoned in developing risk assessment instruments. We started to use it. We thought it was the cat's meow, but thank God someone was keeping track, because a year later we looked up and realized that we had lost 53% of our Latino population. And we said, well, listen, is there a question on the risk assessment instrument that is producing that anomaly? And what was it? There was one question. Do you have family members in the community? And many of the individuals were answering no, because they had someone in their family whose documentation was not quite correct, and they wanted to protect their family member. So they were answering no. Thank goodness we had probation officers who knew many of these individuals from another venue. And they said, Juan has family members in the community, and we want to see family members, significant others in the community. That's going to reduce the likelihood that the individual is going to flee or leave town. So, be very careful with these risk assessment instruments. Questions that you think may be innocuous, may be completely innocent, can produce a ripple effect. And everyone is concerned about immigration issues. So again, something to watch out for. Now, just below that, you see Danner, Beck, and all. Understanding and responding to racial differences in drug court outcomes. And that's in the Journal of Ethnicity and Substance Abuse. And what Danner, Beck is doing there, they looked at graduation rates in Missouri of Caucasians versus African Americans, and they discovered that African Americans routinely did less well than Caucasians, especially in this 18 to 25-year-old range. So again, an excellent read if you have people of color in your court who are not doing well. You may just want to take a peek at that particular article, and it may shed some light for you on how you just may tweak your model ever so slightly and come up with better outcomes. Okay, what about some websites here? Okay, well, the National Council on Crime and Delinquency, and you have their website there, they have many resources there for you, many new models, many new ideas that you could benefit from. Next, SAMHSA has the National Registry of Evidence-Based Programs and Practices. Doesn't get any better than that. And there is your web address for you to connect to hit the ground running. Again, more evidence-based programs and practices. And these are programs and practices that have some scientific backing behind them. And lastly, on this particular page, a fantastic document, and you folks from California need to pat yourselves on the back. This comes from the Chief Probation Officers of California. Serving 18 to 25-year-olds, what are the best practices? You have the website address there that you can log into, and they brag in this particular document, and you can access it, where they have over 450 cognitive behavioral models that may or may not be helpful to your particular jurisdiction. Okay. Next, as promised, the website for the National Clearinghouse for Alcohol and Drug Information. Okay, www.health.org. Or you have an option. You can call their 800 number. I strongly recommend that everybody within earshot of this particular webinar order the entire tip series. The tip series, I think they're up to number 55 now. And again, these are manuals that are put together by content area. And when you call the 800 number, guess what you're going to get on the other end? An 18 to 25-year-old who's going to fill your order. Tell them you want the entire tip series. And now, I'm going to caution you. Give them an address where you want to keep these documents, these manuals, because it's a heavy box. Keep them in the office as a reference point where you can go to and look things up. It's impossible to be in this business and not have a tip series or have access to the tip series, because there's just so much excellent information contained there. So we've got the National Clearinghouse. Another good thing about the Clearinghouse, they will find you no matter how many times you move. I have moved maybe 3 times in the last 20 years, but they always find me. In the box, when you get it, there will be a questionnaire. What do you want to know more about? And you can check off things. And you check, I want to know more about women. I want to know more about working with the pregnant cocaine user. I want to know more about working with the cocaine-using methadone client. That's how the manuals are essentially set up. And do not believe anyone who tells you they know everything. This field is too broad and wide. Nobody knows everything. So again, I strongly urge you to make the phone call and order the tip series. Now, what may happen, some of the manuals may have gone out of print, or they may not have a supply there. What you do, don't worry, because they will send you the ones that you're missing. Sometimes you have to remind them and just say, I ordered an entire tip series and I didn't get 18, 42, and 39. They're very good at following up, but sometimes you have to follow up because, again, you've got that young person on the other end who's attempting to meet your order or to fill your order. Okay, so those are some websites there that would be very helpful for you to hit the ground running, so to speak. Okay. Some information on evidence-based practices. And this, I have 2 slides here. Some of these particular programs may be in transition between best practices and evidence-based. They may not have the data to support being labeled or identified as a evidence-based practice. But let's just take a look at these. And for these, you can Google these. You put in CYT, you'll get Cannabis Youth Treatment. Now, this particular evidence-based practice is manualized, and there's a big emphasis on psychosocial issues. And again, CYT stands for Cannabis Youth Treatment. And when we say manualized, what you get when you order it, it comes in a little box. And it's not easy. You're going to have somebody follow through on this because there are not a lot of them around. But what you need to do is understand that everybody's script is laid out in manualized form. There is a script for the social worker. There's a script for the probation officer. There's a script for the case manager. There's a script for the substance abuse provider. It forces everybody to work together, and everybody then is on the same page. So that's CYT, Cannabis Youth Treatment. Next one, MRT, Moral Recognition Therapy. Now, moral, ethics, that's one of those developmental issues for our young adults, 18 to 25. This I'm familiar slightly with this particular evidence-based practice because I was facilitating groups in Brooklyn Treatment Court, and we had a number of individuals in those groups who are in MRT. Now, something to understand. These are peer-run groups. This is how it's set up. Staff has to be trained on their role in these groups. They have to take a back seat, all right, because we want the peers to run the group. That way we get motivation. Next up, we have FFT. And FFT essentially stands for Functional Family Therapy. Another manualized evidence-based practice that's cognitive behavioral or psychosocial. So again, manualized. I love manualized EBPs because it's very hard for people to deviate from how the EBP is intended to work. You can't go off and do your own thing. Your script is written for you, and everybody is on the same page. Next up, we have TAMAR, which is Trauma-Informed Care, which is designed specifically for women. And I can remember it was either on the 21st or the 14th, we had a number of you indicate that you were working with women. You may have some young women where TAMAR may be appropriate for them. Google it, investigate it, see if it's a match for your particular jurisdiction. We then have the GAINS, the Global Appraisal of Individual Needs. Okay? Something that you should consider if you are working with the co-occurring audience. So again, just plug in GAINS on your Google and it'll pop up. Motivational interviewing. Something that has an extension of stages of change. Many jurisdictions now are training staff in motivational interviewing. The latest one that I was familiar with was Dennis Riley coordinated a motivational interviewing training for the Hudson Valley. Again, realizing that working with this population, you're going to need everybody to at least motivate people to change. So again, motivational interviewing is an EBP that has been used extensively throughout the country. And lastly, on this page, you see seeking safety. Now, this is a trauma. This is intended to address individuals who have suffered trauma. Another manualized EBP. In other words, all of the scripts are laid out for all of the different practitioners who are working in your court, better assuring that everyone is on the same page. Okay. Again, as I recommended to you, Google these and a lot will come up. Now, best practices. Well, and again, I may be off on this. Some of these may have been elevated to evidence-based as a result of getting scientific data. Well, first one you see I have up there is SCRAM. Please don't ask me what SCRAM stands for. We have so many acronyms in this business. But SCRAM is designed for DWI courts. And it has a little notoriety. It's bracelets. Okay? It's essentially making use of bracelets for DWI offenders. This is the Lindsay Lohan intervention. Okay? So again, scratch your head a little bit. Think about it. And lastly, I have up there Smoking Cessation Groups. Well, you think about it. If an individual can get engaged in a smoking cessation group and make some progress in their smoking habit, whether it be reducing or giving up smoking altogether for various different reasons, that helps with us working with them around their substance abuse issue and with their other behaviors. So again, it's cognitive behavioral, and many courts are having positive results from smoking cessation groups. Okay. We have arrived at the last slide. Please don't forget to complete the survey for today's session. And if you have any questions, we have a couple of minutes basically to entertain a few questions, but the questions that you should not have a question for me until you start to explore those websites and look at those references and look at those readings, because again, the world will open up to you. And again, the whole idea was for us to have you hit the ground running. So are there any questions out there? Okay, you guys are camera shy, as we used to say with the high school yearbook. We're not getting any questions, but again, I can remember Lincoln was known as a great orator, and his Secretary of State came to him one day and said, Mr. President, have you heard the minister who's speaking at the church down the street? He's a very dynamic speaker. You should go hear him speak. Lincoln said, okay. Went to church that day, heard the minister speak, and then said what? The Secretary of State came back and said, Mr. President, what did you think of the speaker? He said, oh, he was okay, but he did not challenge them to do anything great. Well, we're going to challenge you with this webinar. Go out there, dig up more resources, more websites, and when you do that, it would be very helpful for everyone, for the field in general, if you find a document that is excellent, that really helps your team, your jurisdiction in improving how you do business, pass that information on to Carolyn Cooper at American University. And that way she can share that with other people in the field, and it's like gathering momentum. So again, it's been a pleasure working with you from September 14th, but if you really want to look at the big picture, the first presentation you had was co-occurring disorders with my colleague Paul Warren. Then I conducted a cultural proficiency, and then we ended up here with young adults. There's a dotted line between each of those presentations. So good luck out there, and we'll see you the next time.